Thank you very much, Minister Dix. This morning, we're here to let you know that late yesterday we had our first case of a novel coronavirus confirmed in a person here in British Columbia through the work of the BC CDC Public Health Lab. So this person is a male in his 40s and a resident of the Vancouver Coast Health region. He regularly travels to China for his work and was in Wuhan City on his most recent trip. He returned to Vancouver last week and had onset of symptoms after his return. On this past Sunday, he followed public health messaging. He was assessed by a primary care provider and a test was done. The protocols were followed in that the medical health officer was notified. The test came here to the lab here at the British Columbia Centre for Disease Control, and late last night we had a confirmation of a presumptive positive here in BC. So I say it's a presumptive positive because our protocols are that the confirmation is done by a second test at the National Microbiology Laboratory in Winnipeg, and the sample is on its way to Winnipeg even as we speak, and our lab here has been in contact with the Winnipeg lab. But given the history of travel, the contact that this person had in Wuhan City and the symptoms they were showing, we are confident that this is truly a case of this novel coronavirus. So Vancouver Coastal Health has been in contact with the family, has been in contact with everybody who needs to be around this case, and is following up with the person and a small number of contacts on a regular basis. The person is doing well and is in isolation at home. So I think I'll leave it there. I know there'll be a number of questions, and it's best that we take those questions, and I can answer any of them that you need right now.
When is the test from Winnipeg expected to come back?
It will take a couple of days. We expect them to receive the test today, and we should have a result from them in 48 hours. Having said that, we have good confidence in the testing that's done here. It's done based on a genetic test that looks for 3 different protein areas, and then we did a whole, not a whole genome, but a sequencing of the genome that matches exactly to what we know to be the published sequence of the novel coronavirus from China.
Seated in the chair here.
There's several rumors of several cases being tested as well. Earlier, late last week, there was a comment from the CDC specifically saying there was several cases being tested. Can you confirm that?
Yes, so we have been, as we've talked about, monitoring people, particularly people who have a travel history, and they are being reported to public health. There's been a small number of people around the province who have been tested for this novel coronavirus, and we have a very low threshold for that testing, so we're doing it out of an abundance of caution for a variety of people, and there have been a number of tests that have been done. This is the first one that has been positive.
Gentleman in the brown coat.
Frankly, resolving is yesterday, Provincial City Councillor James Wong released the media saying that the resident of Wuhan traveled to Vancouver via Shanghai on January 18th. And during her stay here, she developed symptoms on January 22nd and went to Vancouver Hospital, Vancouver General Hospital on 23rd and 24th. Both hospitals released her, are saying that she lacked symptoms. She went back to China on the 25th and was diagnosed immediately with coronavirus. And is public health officer and BCCDC aware of that situation?
Absolutely. Yeah, we are aware of that situation. It's been investigated in some detail, and we can confirm that there is no risk to people here in British Columbia. We've evaluated I think we need to be very careful about listening to rumors and third and fourth hand information. So we have reviewed that case with the clinicians who assess the individual, and we are confident there's no risk to people here in British Columbia.
I'll go in a moment to the lady in the black. I just want to acknowledge that we do have people on the line, and we will take calls after we acknowledge the questions in the room. So back to the lady in the back there.
Can you tell us where this man has traveled when he returned back to Metro Vancouver, and to people who have been to the clinic where he went
No, we don't have a map of where he went. This is a gentleman who was well aware of what was going on in China, and when he returned, he went home and he voluntarily self-isolated. So he had not traveled outside his home until he sought medical attention, and he did that with all the appropriate precautions that we're aware of. So there are a small number of contacts that, including family contacts, and Vancouver Coastal Health is following them and is confident that they have everybody that has any concern about being in contact with this individual.
What about the airport?
There's this person was not symptomatic on his flight. There's no risk to people who are in contact with somebody with no symptoms.
Okay, I'm going to go there and then there. Sorry,
Where does he live?
He lives in the Vancouver Coastal Health region.
sorry, over in Blackcoat.
I think. So that said, will you be increasing screening measures at the airport?
No, the screening measures that we have at the airport are doing what they need to do, and we know that because we've had a number of people identified there who've been assessed. None of them have tested positive, but we have a process that's in place at the airport, and we are providing information to people who don't have any symptoms, who have traveled to the areas of concern, and that information is working as well. We know that because this is a case in point. People are following the instructions on that information and being safely assessed and tested. So the one thing I will say is the federal government, who is responsible for the warnings at the airport, will be expanding the area of concern, and that's because of what we're seeing happen in China right now. We know that it's broader than just Wuhan City, where there's ongoing transmission of this virus. But we have, in BC, had a very sensitive, we've been looking for people who have traveled anywhere in China and doing a detailed assessment, so it won't change the processes that we're using here now.
I'm going to go gray and then up front. Okay.
I just want to make sure I understand. So he had family contacts, those people were tested.
Those people do not have any symptoms, so there's no testing needed at this point. They're all being monitored very closely on a regular basis with Vancouver Coastal Health.
And how many people are they approximately?
There's a small number of family contacts.
And so he had no symptoms though when he arrived and then got the
That's right. He was in isolation at home. He didn't go out because he was concerned, and his family was concerned because he had been traveling to Wuhan City, and so they were monitoring him carefully. And when he had his onset of symptoms, he called ahead and went to a clinic for assessment.
I'm going to go down the front row.
Given you were talking about the airport, how many health safety workers are based at the airport?
I don't have that number off the top of my head. We do have, there's a couple of things. The Canadian Border Services agents are all trained in how to detect symptoms of health issues, and we also have a quarantine service that is available at the airport directly on a 24/7 basis right now, who are monitoring all of the flights that come in. So it is clear we don't have any direct flights from Wuhan province to anywhere in Canada. We do have direct flights from other cities in China, primarily Beijing and Shanghai, that come into Vancouver, Montreal, and Toronto. So that's the areas that we are most focusing on right now.